Hey, everybody. Before we start the podcast, I just want to mention a brief announcement from one of our affiliate sponsors, Sapien CE. Today, 75% of healthcare professionals listen to podcasts for educational learning. Turn podcast listening into reflective learning opportunities with Sapien CE, powered by Learner Plus. It's so great that you can earn CE by just listening to podcasts such as the One Thing podcast. Please check out the link to Sapien CE in the show notes. And by that, you'll also help support our podcast efforts. Thank you so much and enjoy this week's episode. Welcome back to the show, everyone. This is the One Thing podcast, and I'm your host, Adam Rinde. In the One Thing podcast, we're constantly exploring chronic and difficult to treat conditions and asking questions that may budge the needle and help us really understand what the key parameters and key elements are to move forward towards health and well-being. And today, we're homing on a particular pervasive yet misunderstood challenge, migraines. It affects a huge percentage of the population, and all too often, the approach is purely reactive, chasing symptoms with medications. But what if we could fundamentally shift the landscape, intervening for the cascade of events that lead to an attack? What if we could build resilience from the ground up, empowering the nervous system to better understand and withstand life's inevitable stressors? That's precisely what we'll be unpacking today with our guest, Dr. Sui Wong, a neurologist out of the UK who is pioneering a more holistic, patient-centered approach to migraine management. She leverages lifestyle interventions and is grounded in top-notch science. We'll be diving into her framework and what it's like to build that. So whether you're a migraine sufferer or a healthcare professional seeking new tools, or simply someone committed to optimizing your brain health and performance, this conversation is packed with actionable information. We're going to discuss it all and more. Welcome, Dr. Sui Wong. Dr. Wong, welcome to the One Thing podcast. It's a delight to be here with you today.
It's such a delight to be here too, and a true privilege. Thank you so much for the invitation, Adam.
You're welcome. I'm excited to get started here with talking with you about a lot of different things that you're involved with. I thought we'd first start by really hearing the wide array of work that you do. Yesterday, I was doing some research on one of my favorite websites these days, Cite AI, and I pulled up papers that you've been published as an author or co-author and the work you've done. And I noticed a trend in some of the work that you do that's involved with clinical medicine, diagnostics, imaging of real significant disease processes of the nervous system and the eye. And then you have this whole other array to you that, of course, we're going to get into. So I was just wondering, can you talk about what that journey's been like, being really in the heart of medicine and bringing in all different tools and aspects to your practice?
Thank you so much. I'm very active in research because of this concept of, in order for us to make advances to improve the care that we provide the people we see in clinic, we really have to move things forward through good quality questions that translates directly to our patient care. So that very much starts from a patient-facing point of view. And I love being a doctor. I'm a clinician at heart, and I love the healing and art and science of medicine. So that's how it's got going with, writing a lot of research papers. From my first paper in 2001. It was published. So wonderful. From writing case reports and case series to bigger observations to bigger research studies. And a lot of it is actually part of collaborative efforts as well. So it's not just me. It's all part of a network of similarly minded scientists and researchers, clinicians as well. So to answer your question about how it kind of went to that slight different arc, of course, we're here today to talk more about other holistic lifestyle-based interventions. And that journey complemented very well my clinical role. So I'm a neurologist. And also I specialize with vision, so a neuro-ophthalmologist. And I'm very grateful for very high quality institutions and have received really fantastic top-notch training. And I realized that sometimes the way that we can improve patients' lives and improve the outcome of their disease does not just depend on a prescription of medication or surgery. And it could be other things that improves their well-being, improves their brain resilience. And there is evidence to support these practices, but I think the implementation of it can be a bit more difficult because it really requires the opportunity to talk with the person in front of us to really deliver something that is appropriate for them. If somebody wants to talk about something else, such as if they are having a chronic disease, such as lots of migraines or pain, one of the key things we may talk about could be sleep. But at the first visit, that might not be appropriate time to discuss because they may not wish to talk about it. They may wish to talk about the medications that they're currently on, or there are other things where it just feels like it has to be something more. It has to be some other tablet. Sometimes there is, and part of my training is to know what is at the forefront of the science. So it all kind of started with the combination of wanting to be there in service of my patients. And that also coincided very nicely with my own personal journey. So in my training, before we recorded, you talked about how you're very involved with teaching and training. So you will know firsthand about how stressful it is in our training to become specialists or just becoming providers. There is definitely a big difficulty where practitioners or healthcare practitioners would be at risk of burnout, of not taking care of themselves, and they're taking care of others. And certainly I found myself in that situation where I was working extremely hard, trying to do my best for my patients. And really, I didn't really have time to cook. I didn't have time to have a proper night's sleep. And I would be grabbing for the sugary things, grabbing for the ultra processed foods, and just trying to just like get through. And, of course, I would be at tip top attention and at my best at work. But then what was left after work was really nothing too much for people I love, family members, or even for my own self-care. It would be like work and eat something unhealthy and sleep and go back to work. So of course, that is not a very fulfilling, holistic approach. And I started to make a slight change with realizing that I wanted to create a better sense of balance. So it started with a combination of looking at the kind of things I was grabbing for that sense of like, oh, I just need to grab that sugary thing, just like give myself that boost to going, oh, actually, what am I eating daily? And what about things like yoga, meditation, physical activity, and broader aspects of that? So that started to impact a lot on my personal life. And also that was something I was sharing with my family because I thought, this is tremendous. There is a lot of benefits to all this. And there's all this research about it. So what started with me really going really deep, which is kind of my character. I like to go really deeply to understand something. And I go, wow, this is amazing. And then around that time, I thought, if this is so important for myself and my family, why am I not talking to it with my patients? And of course, then I'm aware of the fact that anytime we talk about things with our patients, we have to make sure it's validated and it's certified and various other legislations and also regulations appropriately to make sure that, we are delivering things to a certain standard. So that's when I delve into lifestyle medicine, getting the diploma. So there is an International Board of Lifestyle Medicine, which is part of the American College of Lifestyle Medicine and also the British Society, and there are certifications. So that's how it started for me to bring it in. And over the years, I've been delivering this kind of care to my patients in my clinic. So I work in the National Health Service, which is a public funded service. We have huge volumes of patients. And I found that this approach was very well received and actually creating group clinics. So I also deliver group clinics that allow peer-to-peer support and the discussions of behavior changes or lifestyle interventions that would be suitable, but really coming from the person in front of me, talking about something that they feel right to talk about. And of course, that evolved further to people saying, "Oh, if it's so good, why are we not doing more of it?" And that's when I realized I needed to talk more about it, which is why I'm so privileged to be on your podcast here. That's the drive for me to write books. So I write kind of lifestyle, holistic care, self care books based on the interventions and the lifestyle approaches that benefits our brain health and well being.
Yeah, I can't wait to hear more about the books as we go today. I'm just going to go into this a little bit further because this is really interesting. And I've heard you speak about something that really resonates with me. It's that you're seeing very serious, rare diseases most of the day. At this point in your career and your expertise, you're not seeing just basic general neuro-ophthalmology issues yet. You're still integrating this work in your practice because, a lot of those conversations are very serious, and a lot of times the patients don't feel a lot of hope in those scenarios. Yet I've heard you speak about the importance of quality of life and other outcomes with patients. And I was wondering if you could talk a little bit about that and how lifestyle medicine plays a role in that.
Absolutely. So a lot of conditions, as mentioned, they would be, although they could be rare, some of it could be more common, for example, migraine, but we can talk about that separately. But generally speaking, people come to me, there could be a few things that would be influencing their quality of life and their well-being. So for example, if somebody is coming to me with an autoimmune condition such as myasthenia gravis, so that is one of the conditions I've done a lot of research in. For those who may not recognize that condition, it's a rare neuromuscular condition that is usually autoimmune in nature, and it causes weakness of the body and muscles that also include muscle of the eye. So people could get double vision. Sometimes they get problems with swallowing and breathing and of walking and such things. So it can be very, very severe. So, of course, when people come to me, they are in an active phase of their autoimmune disease. They need rapid intervention for symptom management and treating the autoimmune condition. So, yes, of course, we can think about things that we can use, such as corticosteroids or prednisone, as you would call it in the United States, as an emergency, very rapid introduction. And then there is this really important discussion about how do we avoid the side effects or minimize the side effects of medications that we give. So the classic thing usually starts off with, for example, in this scenario, the side effects of prednisone could be weight gain, blood sugar dysregulation, problems with sleep, thinning of the bones, reducing the immune system, and so on and so forth. A lot of things that we talk about. But then the situation may be that we need to use that medication for its life-saving intentions. And oftentimes we then talk about, when I start talking about the side effects of prednisone, nobody wants to be on it. So then how do we support them? So that's where I start talking about, okay, at what stage they talk about physical activity, we talk about the kind of foods they're eating. And what's remarkable is I was seeing a lot of people taking on board that kind of conversation, really, really liking that kind of conversation. And classically, people who take prednisone would gain weight. And I was really surprised when, we started with this conversation, preparing them to start on prednisone, and they come back on the next visit. They've implemented the lifestyle changes. They have lost weight because, of course, it's all about metabolic health that we were working on. And also it continued to improve whilst they were on prednisone. So that's one of the examples. The other examples could be that if somebody has a chronic condition that leads to worry and anxiety that they're going to get another attack of their condition. So, for example, it could be a inflammatory condition like optic neuritis, nerve inflammation. So somebody could have had that and they're worried about could they end up getting a condition called multiple sclerosis, or is it some other autoimmune cause of optic neuritis, and how do we prevent that? Then we have to talk about things such as their vitamin D. How do they get that? Could it be sunshine? Do we have to think about supplementation? Then we have to think about their immune system. How is their sleep? How is their gut health? What are all these other things that could be influencing their sense of well-being? And how is their physical health? And in this condition of optic neuritis, sadly, some people may get one episode and we can't tell whether they could get future attacks and get diagnosed as multiple sclerosis. And part of the conversation would be about how do they build a really strong foundation of health. So I give the example of going, okay, this is one episode. We do not know whether there's going to be another episode, but what you can do is really build the foundation of your health and really create an environment where your immune system would function as optimally as you can within your control. So then we talk about the impact of sleep on the immune system, physical activity, food, the kind of food, stress, management of stress, the autonomic nervous system, and so on and so forth. Imagine a situation where there is a storm. The building that is deep with its foundation will stay standing despite the storm, but the beach hut that is just doesn't really have a foundation, just gets swept away. That kind of concept seem to really resonate with the people I talk about with the lifestyle. So these kind of things get really people do like to think about what else can they do to feel better. So, it's one of those where, okay, we can't control things sometimes, like whether we get sick, but we can optimize our health so that if we get sick, we are in a better position to recover or to cope with it.
Love it. Yeah. I mean, there's a whole body.
Mm,
The person is more than the process that has developed. They have a whole organism, a whole body to take care of.
yes.
And people really appreciate hearing that because most of their conversations with their specialist is about that one problem in their life because there's only so much time for the interaction. And what about the rest of me? That's
Yeah.
It's really great to hear about how you're talking about strengthening and building and supporting the whole being to weather these storms. And you did touch upon the anxiety about having another flare or the anxiety related to having a disease. I think that's a really important point, and maybe we'll come back to that as we talk about some other things related to mindfulness because I don't want to let that one go because that's
Yes.
very important. So the topic of migraines is so complex. And 20 years ago, when I was sitting in a classroom with one of our mentors, Dr. Pizzorno, Joe Pizzorno, he had an algorithm that he shared about migraines, and he was really involved with migraine research at the time and putting together flow charts and construct to think through a process of helping a patient with migraines. And his first line in that lecture was about the complexities of migraines and, about the unbelievable challenge he had in building this model. Maybe we could start with that. Like, has it become clearer over the last 20 years of what's actually going on with migraines, or are we still in the weeds?
Well, there has been a lot of good quality research done by others in terms of the progress with mechanisms and treatments. There are lots of kind of new pharmaceuticals out there that's been developed as part of these research. Certainly, I've had the opportunity to train with some of them, not in the research setting, but in the clinical aspects, like Professor Goldsby, Peter Goldsby, who's, I think, one of the most inspiring neuroscientist and neurologist who I had the real privilege of learning about migraine from. Of course, I can't learn everything from him because he's so amazing. But certainly I understood some of the concepts and the mechanisms that we need to think about. Firstly, that migraine is a neurological condition. Gone were the days, I hope, gone were the days of saying, oh, it's just a headache. It's not. It's a neurological disturbance. It's a neurological condition. And I feel so touched by people who are researching so much and advocating for people with migraine because sadly, it's a hidden disability. When people suffer from migraines, the most dramatic form of vomiting, shutting out the lights, staying in the bedroom, that is there is only a proportion of it. There is certainly a big number of people who get other things outside of those immediate acute headache episodes. It could be people suffering from brain fog, change in their mood, can't quite think straight, don't feel their usual self, feeling dizzy all the time. And that's not visible. And that's the sad thing, that's not visible. And of course, we do know that there's such a huge impact that, it is the top disabling disease for young women. And of course, it prefer 3-to-1 ratio of women to men. And of course, I see a lot of men also who get troublesome migraine. So, firstly, it's a neurological condition. Secondly, we kind of think of it really as a problem with sensory regulation. And I tend to go with this concept of it coming from the brainstem, certainly shown a lot by Professor Goldsby's research. And then, of course, there are other networks that come with that. But really, it has that origin, likely from the brainstem with the trigeminal vascular system, and that could, get triggered for whatever reason. But there is a genetic tendency for that and contributed by external factors. So a lot of times when we think about what we can do to help people with migraine, for me, foundation of it, the absolute foundation is lifestyle approaches to support. For some people, that's enough to cure their migraine, to treat it. And then they just know what they need to do to keep to a regular rhythm so that they don't tip into getting migraine attacks. For some people, they find that taking their medication for migraines becomes so much more effective because of the lifestyle approaches. And of course, the lifestyle approaches also promote well-being. And because it's such a debilitating condition, things that can promote sense of well-being and improving the brain health is part of all that, of people feeling better. So for me, I usually start off with a discussion about lifestyle if it was appropriate, because of course, like I mentioned at the very beginning, sometimes it's not appropriate. And I think I always think of myself as how can I be of service to the person in front of me? If the person in front of me don't want to talk about lifestyle, I wouldn't talk about it because, I'm not telling them what to do. It's not a lecture. It's more of what kind of conversation can we have here to support their outcome.
Yeah. Meeting people where they're at and being able to read what they have the capacity of taking on and what they want to take on.
Yes.
Going back to these mechanisms of migraines, are the medications these days targeting those mechanisms or are they targeting pain relief? So I know there's one category of medicine that sort of works on serotonin pathways and the triptans. And then there's another category of medications that's more recent that works on CGRP and inflammation. Can we talk about where the medications are going as far as their understanding of the mechanism of migraines?
So my first disclaimer is that I don't prescribe a lot of advanced migraine medications. So I may not be the best person to talk about the most recent advances in pharmaceutical developments.
Sure.
I can talk about the broad principles, of course. So the broad principles, the CGRP medications was really exciting when that happened because it was a case of, wow, we have something to break through this. And it is really exciting, and I'm glad to see it come through, and I can see it really benefiting a good proportion of people. Sadly, though, not 100% of people get response to that. So I think all that feeds into the fact that migraine is a rather complex condition, and it's probably a combination of, for some people, certain pathways are more prominent. And sometimes pharmaceuticals can target things very precisely, or sometimes more in a broader sense on a specific receptor, for example. So the CGRP class of medications have certainly been really exciting development. But the problem is, of course, it's not 100% of people get recover from that. So that kind of background, also same with all the other migraine preventatives, whether it's topiramate or the other classes of medication, or Botox, for example, or various other medications, they can be effective, can be very effective for some people. But the kind of people who come to me Usually they would have tried quite a number of medications. They prefer not to take medications because of the side effects. And that's where I start talking about, okay, what can they do foundationally with their lifestyle? So I have a very systematic approach to it. I like to be systematic. You can probably tell from my research approach. so,
Yes.
yeah, so I share this framework where, firstly, the key principle in migraine, which is really accepted in the conventional community, would be about regularity. Regularity is one of the cornerstones of people who have migraine, maintaining that. So, and it's also certainly known and accepted about things such as sleep and various things like, whether there's fluctuations in caffeine, drinking, or blood sugar swings and such things, so on and so forth. And I was thinking about how does this apply with the kind of concepts that some people say, okay, do this lifestyle thing. Some people say, do that lifestyle things. And it made me think that a lot of these lifestyle things, they make sense. And it's hard to just pin it down to one mechanism. It probably has lots of mechanisms. So, for example, sleep is one of the approaches I take. So, the approach I take is I shorten that to the acronym called BRAINS, which really is about building brain resilience and balancing the autonomic nervous system. So, starting with the building brain resilience, there are a few aspects, and one of them is sleep. So, for example, if we talk about sleep, we can see about how sleep has a detoxification process. If there is somebody has a good quality sleep in the deep sleep phase, the lymphatics are working to flush out any toxins and such things. We can see that sleep is really important for inflammation or immunity function of that. We can see that sleep is really important for emotional regulation, how people manage stress. We can see the impact of sleep on how people reach for sugary things as a stopgap. And that leads to fluctuations of blood sugar and about energy systems. So that could be that. We can see also how sleep could affect the gut. And then we can think about how the gut and the brain is connected. You are so much more of an expert on gut health. So I'm sure you've talked a lot about that with your listeners. So the other aspects, for example, physical activity. So that is another key thing of the brain resilience in addition to sleep and gut health. So physical activity, let me think about how could physical activity be helpful? We know that low to moderate intensity, so-called zone 2 in the exercise physiology world, can be very helpful for a few things. It could be working through the metabolic pathways, improving metabolic flexibility. It could be helping with clearance of the brain toxins, because we certainly know that zone 2 is really helpful when somebody has other conditions like concussion or something like that, to help clear things. We know that physical activity can also be a really helpful mood regulator for stress relief. And that comes in with how stress is a big part of the process of migraine. I'll talk about that a bit more in a moment. But these are kind of the examples where we go, all right, so we have, and then we have nutrition. So we talk about nutrition and the nutrients that we're getting. What kind of foods? Do we have enough magnesium? What's the diversity in the food? Are we limiting ultra processed foods that's affecting the gut microbiome? And, are these foods promoting the creation of the short chain fatty acids, the anti inflammatory compounds, and lots of other beneficial compounds by improving gut health? So from nutrients to, what else is are in nutrients? Of course, you get all the different types of minerals. So it's not just magnesium. Magnesium is a big part of it, of course, which is one of the things I oftentimes start with thinking, how are they with their overall nutrition and nutrients? And of course, that comes in with metabolic health, which is another part of the building brain resilience. We do know from the research in migraine that there is strong support for the importance of blood sugar regulation. So now the question is it the dip in blood sugar or is it the spike in blood sugar? I think we can interpret data in different ways. And I suspect that it's a combination of both and all that, meaning it's probably a case of fluctuations. For example, spikes in blood sugar could trigger inflammation pathways, for example, oxidative stresses. It can affect the blood-brain barrier. It could lead to insulin resistance, which then causes also not just the body insulin resistance as brain insulin resistance, how then it affects the energy pathways of how we can use energy better, with the glucose or the ketones or the B vitamins. So there are all these aspects that come from the combination of nutrition, nutrients, and metabolic health. So those are the kind of examples in building brain resilience. And there is also the mindset approach of how we help people build in the suitable habits. And then the other part is the balancing of the autonomic nervous system. That is really key. People who have migraines oftentimes observe something called a post-stress effect, or the holiday migraine or the weekend migraine. It's the come down after a highly stressful period. So it's a very valid comment where people go, it's not stress causing my migraine. When I'm stressed, I don't have migraines. It's when I'm relaxed that I get migraine, hence the holiday migraine, the weekend's migraine. Of course, for some people, it's the ramping up of the stress times, like the Monday migraines. So it is very individual. And that's the key thing we should remember, I think. I always try to remind myself, certainly, that everyone is an individual. All I'm doing is I'm hearing what they're saying, I'm reflecting on their observations, I'm sharing the knowledge I have and see how it comes together in a way that it makes sense for them or not. So in that situation, like the stress, if there was a case of the come down migraine, the post stress, the come down effect, then we talk about how to regulate the autonomic nervous system better. Your listeners will know very well about what the autonomic nervous system is. Just to briefly summarize, it's the part of the nervous system that helps with automatic functions like blood pressure, pupil dilatation, sweating, heart rate, and so on and so forth. And we have two parts, and it's not about one being good or one being bad. We need both. And that's why I say it's the balance. So the one part of it is the sympathetic. Some people think of the get up and go, or in its extreme, the fight or flight. You just have to really get going, the cortisol response, and so on and so forth. And of course, you have the parasympathetic, the rest and relax, or the rest and digest, that is really needed for us to have good quality sleep, to digest our food. And we need both. For example, waking up in the morning, we need our sympathetic, our cortisol to kick in to get us up and ready. We have a presentation, we need that to kick in. We have to pay attention and get some tasks done. So it has its value. It's only when it's out of control, when somebody's in a chronic stress mode, they're constantly worried about something, or they are not able to manage that because of the circumstances or additional things, or with their health, or sometimes to do with other things impacting like sleep. I mentioned about how if it's affected, it could affect stress management. And of course, stress affects metabolic health. The cortisol causes blood sugar to be higher than it should, affect insulin response, so leading to likelihood of insulin resistance, metabolic dysfunction. So it all intertwines, both sides of the brain's framework. And the autonomic nervous system, I talk about things like mindfulness or visualizations or breath work, mind-body connections. And I think that's really, really important for us to think about, that we are part and parcel of all of it, and seeing which one comes in at that time, and really having the approach of working towards all of them to think, okay, which one do I need to position more? And that is when I see the magic happens.
Yeah, so I'm just going to back up a little bit on some of the things he said because there was so much wisdom in those comments. One thing I'm hearing, sort of a pillar or foundation or platform to stand on with migraine sufferers, is this kind of sensitive nervous system and sensitive to changes or disturbances. And I would double down on that. That's common amongst almost all migraine sufferers, is that if there's a variability in their environment, whether they're exposed to like an odor or smoke or sleep disruption, or it's so beautifully said that that's a kind of foundational piece.
Oh, yeah, absolutely. So another way I describe it is thinking of how when we manage these foundations, thinking of, for example, the brain's approach that I just spoke about, it really reduces the likelihood of a little change to tip somebody into migraines. So the analogy I oftentimes describe is like a pot of water that's overboiling. And thinking of the water overboiling, like when somebody tips into migraine attacks. When that happens, we've got a few things we could do. We could pour some cold water on top. It temporarily stops it, but we can't keep pouring water because then the water will overflow again. So that's like taking painkillers or something immediate. But what we probably would be better at doing for the longer term is to turn down the fire. So turning down the fire means it's less likely for the pot to tip over. And those foundational aspects I mentioned really reduces the likelihood of people having migraine. Because when I first start this approach, usually people will kind of commit to 3 months of doing this, and then they see a big change. And that's when they notice that, all right, okay, it's good now. I have this late night, I'm still okay. Same thing like if people get menstrual migraines, some women get it around the time of the menstruation, and they find that they manage all these foundational aspects. When they have their menstruation come, oh, not so much of a problem. You see, so it's about reducing the likelihood. And also, there are other things that people can do because sometimes, yeah, there's a little bit of a heavy hangover thing. Then it's a case of, okay, what kind of rescue strategies can we do? Shall we do some breath work now? We're just going to stop the attack from the worsening. Do we need to kind of get further things in place? So, for example, if somebody's approaching a big deadline like an exam or a big presentation, then it's a case of in the lead up to it, being particularly careful with the brain's foundation approach so that when the big presentation comes, the after effects is like, oh, it's okay. It's not a massive thing. Or it's like, oh, after the presentation, I know I'm going to be more aware of my blood sugar from the food I eat and aware of how much alcohol I'm drinking so that I minimize the tipping over. Because sometimes when there's more and more things adding to the picture, then the pot is more likely to boil over.
Very nice. Yeah, I was thinking a good plan would be finish the exam, drive to the sensory deprivation tank, then visit your chiropractor,
Yes.
maybe visit your acupuncturist, and then go home.
Yes. Yes, absolutely. Get a massage, go for a walk on the beach, appreciate the beauty of nature, go forest bathing, get the benefits of the ions.
So hitting the pub wasn't a good idea, huh?
Yes, 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 absolutely. Because of course, what usually happens is the typical approach I see many people take is that, oh, I've worked so hard. I'm going to celebrate, go have drinks, go have a lot of specific types of food that they may not have, like, highly processed or foods that cause sugary spikes because they feel like they've deserved it, which I understand. And understanding how that then leads to this massive migraine after that gives them a choice about what they may wish to do. Or they may have that pizza with a salad first, so it stabilizes things, but perhaps 2 days later after they come down.
Yeah, I've never heard that before about the come down effect, and it makes a lot of sense. I think that alone could be life changing for people. And also, I think there's this message that you're delivering that I really want to reflect back to you and see if this is part of what you're doing. So there's the pot, and I see the pot as being how well you can hold the environment and how well your systems are basically containing the environment. Environment being everything that's coming at you, going into you, processing. And then there's this concept of self regulation, avoidance, decreasing triggers, decreasing exposures, modulating behaviors. And so there's this kind of like balance between these two. So a lot of your work seems to go into strengthening the pot while also being aware of, the things that are going to stir the pot basically.
Oh yeah, absolutely. So if the water is really close to the boiling over point, then we just need to rapidly turn it down. And if the fire is really, really big because of numerous factors at the same time, then we can see, the pot is about to boil over, it's then about modulating and turning it down. So I think of it more of the fire. How do we control the fire underneath the pot? And I think of the pot of boiling water is just the way it is. Because if somebody's got a tendency for migraine, they just know that when there's enough things to heat up the water to a certain boiling point, it may just tip over because it just boiled over the pot. So it's kind of along those lines I'm thinking of, which when I talk to people about it, they feel empowered, moving from a place of fear, food avoidance, trigger avoidance, do not know what to do, feeling that they can't do anything, they can't go out. It's a very limiting lifestyle, to going, okay, I set my foundations now, I know how to maintain it, and then going to this wedding, sleeping at 2 a.m. is really important because fact, social connection is important. And just knowing that it's fine because the next day I know what I need to do, hydrate a certain amount, plan that specific nap, do that specific activity the next day. They can work around the big event to avoid what would typically become a tipping point to the water boiling over.
Yeah, yeah. And I think, some of these practices that you're talking about also is, the long-term effect of them is strengthening their resilience so that these tests or these challenges or these variables will ultimately have a higher threshold before triggering symptoms or triggering a migraine. So before we leave this segment, I just really appreciate something that I've heard you talk about, and I want to share it with our audience. Is there's the migraine, but then there's all the things that come along with the migraine. So the comorbidities. And can you just kind of talk about that? Because some people who haven't had a migraine might just see it as like, well, you've got this really bad headache and, it'll go away over after a period of time. And they don't understand the granular details of the migraine sufferer's life and comorbidities. So maybe you could just sort of enhance our understanding of that.
Yeah, I think that's a really, really important question. Thank you for asking that, because that is the part where in my practice, is the most disabling, because oftentimes people don't get the diagnosis yet. They just feel like, oh, I do not know why I don't feel right. So just to think about it, I just think of, okay, in migraine, you have lots of phases. You have the prodrome or the premonitory phase, the leading up to the migraine phase, where there could be other neurological symptoms. There could be a lot of yawning. There could be a lot of thirst. There could be craving for certain foods. And there could be a mood change, a concentration change. Can't quite find the words, and so forth. Various neurological things, dizziness, or vision. And then you then get the aura phase, but not everybody may get the aura phase. The aura phase is classically seen as either a vision disturbance, which is why I see a lot of migraines, because it starts off with like vision disturbance that spreads from one side. It takes 5 to 10 minutes to reach its worst, usually stopping at the middle of the vision, affecting both eyes. And then it just starts to fade away after another 10 minutes. And then it's then followed by the headache phase. The headache phase is very classically one-sided, pounding, throbbing with heightened sensitivity to light, to sounds, to smells, vomiting, trying to stay still because movement really worsens it. And then there could be, some people think of a separate phase, some don't, of an abort phase. So that could be like a quick nap to just stop it. And then after that, there is a post-drome, the hangover effect of migraines. Again, it could be similar to the prodrome, or it could be a mirror effect of it. So for example, there could be a change in the mood, the thinking process, and, the way the brain is thinking, sharpness, making errors, and just people kind of probably thinking, what's wrong with my brain? And of course, that's the after effects of migraine, the post-drome. And although we classify it in such very clear sections, the kind of people I see, I suppose, would be the more complicated ones, where it doesn't very clearly demarcate it like that. It probably one melds into the other, where they often have this low grade vision, dizziness, visual sensitivity, and feeling this heavy hangover effect, a bit brain foggy, can't quite think straight, mood is changing, and then they get periods of it worsening with more of a headache feeling, and then that then settles back down. So there is this chronic effect. So all this reflects that it is rather complex. And of course, it could be other things, not just the vision things. The aura could be a sensory change of the body, which is why for some people, they may be thought to be having a stroke because in this very dramatic form, some people may get paralyzed on one side. And the right emergency setting is to assume it's a stroke, go to the emergency department. And then, of course, usually what happens is that it then resolves. There is all the other migraine things. The scan's normal. There is no stroke. But then it's like, that's a complex migraine, a hemiplegic migraine, for example. So there are variations of how this is affected. The ones I find that is really very debilitating would be just the chronic low-grade effect where people they just don't feel themselves. They don't feel so sharp. Everything is much slower and people don't understand.
It's really great to explain that experience because it's the before, the during, and the after that really has to be supported. And, it's not just, well, next time you get a migraine, take this medicine or take this medicine to prevent a medication. A migraine is a whole experience. And I think it's really important for us to understand that. So I know we're almost out of time and I could talk to you for hours. I wanted to leave time for a few really important things that and we can maybe do another session or podcast later. But so first, I just want to hear about your books, sort of where people can find your books and, just kind of talk about the titles of, kind of the work you're putting out there.
Thank you. I appreciate that question. And I would love to come back to talk more about mindfulness. There's a lot to talk about. In terms of my books, I mentioned about my motivation is to be able to share knowledge that empowers and to support people to take action. Because I'm very privileged to be able to care for a lot of people in my very busy clinical practice. And that's where I've noticed how I can support people to implement sustainable changes that supports their brain health and well-being. So to that effect, I've written 3 books that goes into that further. There is the Mindfulness for Brain Health book. I share more about self-care approaches for people to create mindful moments throughout their day and about the scientific reasons, and actually it's very practical so that people can just take action. And if they like my voice, they can get access to my meditation voice.
Very nice.
It comes free with the book. I have this I'm really excited about. I spoke a lot about metabolic health because I find that is really important with brain energy. So Sweet Spot for Brain Health talks a little bit more about what we spoke about with the inflammation, the blood-brain barrier, and about actually really practical things. It's not about abstinence, not about avoiding blood sugar. It's more about how do we support that. And the third book, which I missed the trick there because I gave that as a present to somebody else. It's called Break Free from Migraines Naturally. So it's a yellow cover, and it's really the lifestyle approaches. And these books have been well received. Then the other 2 books are really more like practical action books, workbooks. So sleep is really important. So I've got this workbook called Sleep Better to Thrive, and really takes people through, little things where they just go, okay, understanding what's important, but just enough to go, this is enough knowledge now. What do I need to do next? So it's really an action-driven book, also very practical. I'm grateful for the lovely feedback. And I like gut health conversations. So quit ultra-processed food really comes with that because I see that a lot in my clinical practice about how ultra-processed foods affect our brain and our body. And I was like addicted, maybe too strong a word, but I was really reaching for ultra-processed foods as my go-to foods for years. And I find that it actually was really hard to transition. And a lot of all the approaches I share would be based on researching into what kind of practical things and from my experience. So those are the books. People can find them on Amazon by searching my name, Dr. Sui Wong, Suiwong, or they can connect with me on my website, and I would love to connect with your listeners. My website is drsuiwongmd.com. So it's drsuiwongmd.com. And there is a page for my books. And also what is exciting is the Thursday Tips newsletter. So every Thursday, I write a short newsletter that's just less than a minute, 1 minute read approximately. I share 3 tips and I leave the reader with 1 question. It's a really lovely way for me to connect to my readers, people through other people's podcasts. And yeah, it's really nice to hear the feedback. So I love to connect with your listeners through these methods.
Yes, and I encourage everybody to connect with you as well. That's so great.
Mm.
Thank you. If there's any parting words you want to share with us, that'd be great. Otherwise, it's been great to visit with you. But I'll turn it over to you if there's anything else you'd like to share.
Yes. And very, very grateful for the organization, nonprofit called Visual Snow Initiative, who have done amazing work to progress things in the field of visual snow research and treatments and helping support people. Really amazing organization. And they've funded me for my research. So I should be clear about that.
And real briefly before we wrap up, if we get 300 listens on this podcast within the first 30 days, we're going to dedicate this to visual snow research. And I just would love for you just to comment briefly about supporting visual snow research and the condition. And I have a special friend in mind with this dedication that I know suffers from this condition. So I'd love to kind of wrap up with putting out there to support visual snow research.
Oh, thank you. That I'm very touched by that because I think that visual snow syndrome, which is one of the areas I research and look after people with that condition, it's under recognized. We need a lot of progress to help people and support them. So yeah, that's I'm very touched by that choice. Yeah, I think I replied to your email. I said something like a local charity of your choice. So so I'm really touched by your
Yeah.
decision to choose visual snow.
Thank you. Yeah. So, yeah, if people, we'll put links in the show notes, and I think people, getting familiar with the big need of understanding visual snow syndrome, and hopefully this podcast will serve that as well as many other purposes. So, well, thank you so much for being here, and I look forward to our future conversations. Getting back together and talking about mindfulness and other things that you're involved with.
I look forward to that. It's such a great pleasure to be here. Thank you again, Adam.
Thank you so much for tuning into this week's episode of the One Thing podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing podcast. And again, much appreciation for you being here with me.